The brachial plexus, which can also be referred to as plexus brachialis, is a somatic nerve plexus that is formed by the intercommunication among the ventral rami, that is the front roots of the lower four cervical nerves, and the first thoracic nerve. These lower four cervical nerves are from C5 to C8, and the first thoracic nerve is T1. This interconnection of nerves is actually responsible for the motor innervation of all the muscles of the upper extremity, with the exception of the trapezius and levator scapulae. The trapezius is actually supplied by the spinal accessory nerve, that is the cranial nerve 11, while the levator scapulae is supplied by the cervical nerve 3 to 4 and dorsal scapular nerve. The brachial plexus also supplies all of the cutaneous innervation of the upper limb, except for the area of the axilla, which is supplied by the supraclavicular nerve, and the dorsal scapular area, which is supplied by the cutaneous branch of the dorsal rami. Please don't get confused whenever you hear cutaneous innervation. It simply means an area of skin which is supplied by a specific cutaneous nerve. The brachial plexus also communicates with the sympathetic trunk through gray rami communicantes, which then joins the roots of the plexus. They are derived from the middle and the inferior cervical sympathetic ganglion and the first thoracic sympathetic ganglion. In this video, we will discuss the subdivisions of the brachial plexus. The brachial plexus is subdivided into roots, trunks, divisions, cords, and the branches. A lot of mnemonics can be used to remember these architectures. Example is, really tired, drink coffee black. Really stands for the roots, tired stands for trunk, drink stands for divisions, coffee stands for cords, and black stands for branches. Ordinarily, the brachial plexus is composed of 5 roots, 3 trunks, 6 divisions, 3 cords, and terminal branches. We will take them one after the other. The ventral rami of the spinal nerves C5 to T1 are referred to as the roots of the brachial plexus. The typical spinal nerve roots result from the confluence of the ventral nerve rootlets originating in the anterior horn cells of the spinal cord and the dorsal nerve rootlets that joins the spinal ganglion in the region of the intervertebral foramen. The roots emerge from the transverse process of the cervical vertebra immediately posterior to the vertebral artery, which travels in a cephalocaudal direction through the transverse foramina. Each transverse process consists of a posterior and anterior tubercle, which meet laterally to form a costotransverse bar. The transverse foramen lies medial to the costotransverse bar and between the posterior and anterior tubercles. The spinal nerves that forms the brachial plexus runs in an inferior and anterior direction within the sulci formed by these structures. Shortly after emerging from the intervertebral foramina, the two roots come together to form the upper trunk, that is C5 and C6. The suprascapular nerve and the nerve to the subclavius arise from the upper trunk. The suprascapular nerve contributes sensory fibers to the shoulder joint and provides motor innervation to the supraspinatus and the infraspinatus muscles. The ventral ramus of C7 continues as a middle trunk. The ventral rami of C8 and T1 unite to form the lower trunk. Each trunk splits into an anterior division and a posterior division. This separates the innervation of the ventral and dorsal aspects of the upper limb. The anterior division usually supply the flexor muscles, while the posterior divisions give supply to the extensor muscles. The cords of the brachial plexus are named according to their relationship with the axillary artery, and they are the lateral cord, the posterior cord, and the medial cord. The cords pass over the first rib, close to the dome of the lungs, and continue under the clavicle immediately posterior to the subclavian artery. The lateral cord of the brachial plexus is formed by the union of the anterior division of the upper and middle trunks. It is from this lateral cord that the lateral pectoral nerve originates from. The anterior divisions of the lower trunk forms the medial cord, which gives off the medial pectoral nerve, the medial brachial cutaneous nerve, and the medial antebrachial cutaneous nerve. The posterior divisions from each of the 3 trunks unite to form the posterior cord. The upper and lower subscapular nerves leave the posterior cord and descend behind the axillary artery to supply the subscapularis and teres major muscles. The thoracodorsal nerve, which supplies the latissimus dorsi, also arises from the posterior cord. In the next video, we will talk about the different branches of the brachial plexus and also some important clinical conditions that is associated with the brachial plexus. Also, the variation of the brachial plexus and blood supply to the brachial plexus will also be discussed. See you in the next video.